Welcome to Adapting Class. So in this video, we will be talking about GCS, how to calculate it in the case form, in the scenario. You want to stick around. I have a video that I did on GCS. This is the practice questions, how you see it on the NCLEX and how you should be able to feel comfortable when you see questions like that. So we'll go through the cases and I will give you a brief overview of what GCS is, and then we can use it to answer the question. First, what does GCS evaluate? It evaluates three things. Usually your eye movement or what you see, verbal, and the modal response that you can give during evaluation of a neurological status. The E talks about your eyes. The V is your verbal response, and the M is your modal response. Each of them is testing something related to your brain. And this is how you can figure it out. Your E usually tests your brainstem and alertness. Your verbal is usually your orientation and communication. And the modal follow command. So this is the video I did already, but this is a brief evaluation. If you want details, I will link it in the description and you can watch it. The E will give you a score of 4. And then the V is your voice, your verbal, you get a score of 5. So when you calculating, the modal will give you a score of 6. In actual fact, the total GCS is 15. If you're not doing anything at all, you're going to be 3. There's no 0 GCS. There's either 3 or you all the way 15. That means I is doing fine, verbal 100%, and your modal is excellent. How do you remember it? Your eyes is usually will give you 4 points. How? Spontaneous eye movement will give you 4. Sound, when you open your eyes, you get 3. And when you open your eyes or after pain with your eyes, is usually 2. And if there's no eye movement at all, no eye opening, nothing like that, you get 1. How do you remember it? This is the easy way to remember it. No pain, sound good. If you have no, you get 0, 1, right? If you have no, you get 1. Pain, usually you get 2. And if you make a sound, if you open your eyes after a sound, you get 3. And if you just open your eyes spontaneously, you're going to get 4. So no pain, sound good. Now, let's look at it. What is the verbal response going to give it to you? The verbal response, there's 5. And I like this mnemonic because it's easy to remember them. No morning, random, confused words, right? 5 points. If there's no verbal response, you get 1. If you make a response by you morning, that means it doesn't make sense. Nobody can hear you, right? You get 2. But if you make a sound and it's inappropriate, based on the question they're asking you, you are not responding to the question. You're saying something, we can hear exactly what you're saying, but it does not make sense. You get 3. If you're confused, you get 4. And if you're rented, you get 5. So no morning, random, confused words is what will give you the GCS information. That is the easy mnemonic I want you to pay attention to. For example, a client says random words, and you see random, you know definitely that patient is going to get 3. These are little things you can use to calculate GCS. The modal function is very straightforward. I use the acronym OLD BEN, and this is it, OLD BEN. But this one is flipped. The first letter is the highest you can get. So O means you obey command. You get all the way 6. The L, you localize the pain. And the D, you draw away from the pain. When you flexes, that means you bend towards that pain. I will explain to you later how this is very important. There's a question, I don't want to give it away. You get what? 3. And when you extend it, you get what? 2. If you don't make any modal response, you get 1. For example, a patient localized pain by pushing away the nurse's hand is a form of what? M5. So this is the generalized buzzwords, acronyms, mnemonics you can use to remember them. If you're having issues remembering all these GCS information. It's very good in assessment. If you're in nursing school, you're making an assessment. That is the easy way, or you can pull your card. But on your exams, you got to know how to wiggle your way through. Now, let's look at how to solve them. I have 12 questions. We're going to, there's some of them, it will be a scenario form in the case form, and then we go through it. There's some, I'll give you answers, and then you can answer them. What do you think? We're going to practice this. A 45-year-old client opening their eyes spontaneously, right? Patient is oriented to place, person, and time. 2, and the patient obeys command. Calculate, I'm giving you 10 seconds, calculate the GCS for this patient. If you are assessing the patient, 45-year-old client, opening their eyes to what? Spontaneously, right? And then the patient is what? Oriented to place, time, and person. And the patient follow command. What is the GCS score? Put down your answer in the comment section and let me know that this is the way the question would be. This one you have to calculate yourself. So let's look at the answer. E is 4, V is 5, and M is 6. Why? The patient opening their eyes, what? Spontaneously is going to get the fullest, the highest E exams. That means spontaneous eye movement. If you use no pen, sound good. That means his eyes is open. That means sound good. It get the full 4. And then what is the verbal, right? Patient is oriented, right? It's not confused. Oriented to place, time. It can get all the verbal assessment the patient can get 5. And then obeys command. That's the model. It gets 6. So a total of 15. This is the way the question would be. Now, let's look at another question. During a shift assessment, a nurse notes, same thing. You open your eyes to speech, you confuse, right? Confuse conversation, and localize the pen. Look at what I've done to you. What is the client GCS, right? Is he 8? Is he 10, 11, 12, and 13? 10 minutes, 10 seconds. Put down your answer in the comment section. Hashtag put number 2. And let me know what you think. 10, 11, 12, or 13. There's a way you can learn them. There's a trick, right? Patients do not open their eyes spontaneously, open their eyes to speech. Therefore, they're not going to get all the full point. Patient is confused. Patient is not oriented. Therefore, he cannot get full point for the verbal. Patient localized. That means it's not obeying command. Cannot get full point. So you got to subtract points from it. Based on the calculation, it's losing 1 point from each. If the total is 15 and you losing 1 point, you're going to have 12. And so this is the problem. E is 3 because opening the eyes to speech, not spontaneous. If you use no pen, sound good. And the verbal is there, no morning random. There's what? Random confused, which is what? 4. And then obey, localize, right? The patient obey, localize, burn, that's old burn. You get what? The total of 5 instead of 6. And that total will give you 12. This is the way you calculate the GCS. Now, the next question, like I say, is a practice. There's some will give you a scenario, some will give you the answers. Now, look at this. You have 20 seconds, read the question, then you put down your answer, think about it. A nurse is caring for a client who does not open their eyes, right? No eye opening. Has no verbal response. Patient has no verbal response. And the patient is having what? Decelebrating posturing. What do you think? What GCS will you give this patient? Number 3, hashtag number 3. Put that in the comment and then put your answer. What do you think? What would be the GCS for this particular patient? What is the E? What is the V? And what is the M? 10 seconds up. E is 1 because the patient is not doing anything. He cannot get 0. No verbal response. You can get 0. You can get 1. And then you what? Decelebrating. Remember, old, bend, right? Obey, localize, draw, bend, and extend. Decelebration is an extension. Therefore, this patient get 2. A total of 4. This is a bad head injury. Patient is in trouble. How are you doing? What is your score so far? 3 out of 3. I hope you get 3 out of 3. But be comfortable in calculating GCS. I'm doing this so that you can be comfortable when you see this kind of question in the nursing school and exams. They are very free questions if you know how to get them. Now, the client GCS dropped from 12 to 7 over the past hour. A drop in GCS. What should be your action? What is the next priority action? Do you document the changes and continue to monitor this patient? Do you prepare to intubate this patient? Do you perform a full neurological assessment and find out what is going on with this patient? Or do you increase in neurological check to like every 15 minutes because the patient GCS is dropping? 10 seconds. What do you think? Just think about it. GCS is bad. From 12, it's not normal. It has even decreased by 5 points. Are you going to document this prioritization? You got to be sharp. Prepare to intubate the patient. Do you perform full neurological assessment or reassess the patient multiple times? I hope you got this one. You got to prepare to intubate. The buzzword is what? 7. And a GCS below 8, or you have to be intubated. This patient airway is not secured. This is the tricky questions you may see. A drop in GCS down by 5 points and below 8, we need to intubate this patient. You don't need to reassess the patient anymore. You need to call the doctor right away so that we can intubate the patient. There's no need to monitor this patient. That's a bad injury. Number 5. This one, we got to calculate. And intubated, that's the buzzword. Patient is intubated. Is in the ICU. Open the eyes to voice. Use what? No pain, sound good. That's the eyes. If there's no pain, right? Pain, what number would you give? No pain, sound good. That's the E. And what is the V? Cannot speak due to the ET2. And I said, no morning, random confused words. What do you give the V? And the M, localized to pain. Old Ben said what? Obey, localize, draw, bend, extend, and none. What GCS will this patient get? What do you think? Put down in the comments. Stop the video. I'll wait for 10 seconds, and then you can put in your comments and let me know. But what GCS will you give this patient? You can see this is a bad problem. The key concept is what? Open eyes to voice, the patient is going to get 3. But remember, patient cannot speak because the patient is intubated. They don't get 0. They get 1. But you got to put a T. So if you see T there, that means it's indicating that we cannot assess a full verbal response. Therefore, we're giving them the lowest they can get, not 0. They're going to get 1. And since I'm localizing, old Ben localize, I'm trying to find where the pain is coming from. I will get a little bit, they'll subtract 1 from me, and I will get 5. So this patient is total of what? 90. And so that's the GCS for this patient. Now, this one, I know you can get it. The same strategy. And next is assessing the client after a motor vehicle accident. The client opened the eyes only to what? Pain. So eye movement, ask yourself, no pain, sound good. So what level is the pain? I'll open my eyes only when there's a stimulation of pain. And then make incomprehensible sound. That means it does not make sense at all. You don't even know if they're speaking. Withdraw from painful stimuli. Therefore, assign the E. What do you think is the answer for this? Is it 6? Is it 8? Is it 9? Or is it 10? Just go through each steps and circle the keyword. Look at the eyes, pain. What would you assign it? Look at the speech. It said incomprehensible. What would you assign it? Look at the withdrawal from pain. That's the motor function. What do you assign it? The way I'd like to do it is look at the eye. You say the eyes is not spontaneous. It cannot get what? 4. It's not making some high movement. Therefore, it cannot get 1, right? And then no sound is when you hear it. Therefore, you can't get 3. You have to get 2. Incomprehensible means no mourning. That means you just below just no. Therefore, mourning is the same thing as incomprehensible. You get 2. If you withdrawing from pain, is a little bit lower than what? Obeying, but it's not withdrawing or extending or flexion. You see how you can break it down. That means you're going to get a point. They'll subtract 1 point from you from not obeying command. And therefore, this is the right answer. And this is how you can calculate. This is the way you got to make yourself, wiggle yourself through, and you'll be able to get these numbers. They are not that difficult. It just takes some time. Don't run away from these questions. You watch this video multiple times, you can see that these are not that difficult. You have a trauma patient. Extend their arms and legs. What? When you apply a painful stimuli, the arm rotate internally and then what? The wrist flexed. This is NCLEX key model exams. I want you to know this, write it down, take a picture of it every day, watch it. This is a model exams that they like to give you. They can confuse you. Extend their arm and the leg when you apply painful stimuli. That's motor respond. And then their wrist would do what? Flex, and then the whole arm internally rotate. What do you think? Is this going to get a motor response? What do you think you're going to get? Are you going to give 6 to this patient? 5, 4, 3, 2, 1. Strategy. You know they're doing something. They're not going to get 1. You know they're not following command. Therefore, they're not going to get 5. There's no localization, right? And there's no withdrawal. So you're left with what? Extension and flexion, right? Is either they get 3 or 2. How do you know this is 3 or 2? That means decerebrate or decortication. This is the strategy, right? This decort is the COT is core. So your arm go to your chest. Decortication means you flexing. So the C inside means your core of your body, and that get 3. And then the other one, deceleration, the E is the extension. You get what? 2. So use this mnemonic strategy to know the difference between extension, that means deceleration, and then called flexion of the arm to the chest is decortication. Now I give you this GCS. Patient client GCS is for E3, V4, M6. What do you think? You just have to add them together. 3 plus 4 plus 6. What would it give you? And what kind of head injury is that? This is what? 7 plus 6 is 13. Is it a mild head injury? Is it a moderate head injury? Is it a severe injury or vegetative state? Pause the video, like I'm pausing it for 10 seconds, and then put down your answer. Think about it. You have to know the difference between a mild injury, moderate, and a severe injury. We don't use vegetative state to calculate GCS. You probably use GCS of 3, but we consider everything less than 8 as a severe head injury. This patient has a mild head injury. So this is the normal You can take a picture of it. You can write it down. But mild head injury is 13 to 15 and moderate 9 to 12. Anything less than 8 or below is a severe head injury. Now, I know by now you're warming up. Now it's getting tough. This is a clinical application. Neurological questions. If you need more, I have videos on neurological, how to identify these kind of problems. The client has a GCS of 11, right? It's mild head injury. All of a sudden, they have unequal pupils with the right fixed pupil, right? And dilated. What do you think is going on? If you're taking care of this patient, you're taking the NCLEX and you saw this question and they ask you prioritization question, what do you think would you do? GCS of 11, head injury. But then I have unequal pupil and fixed. What is the definition of this? What is happening? Put down your answer and you think about what is going on. This patient GCS is very high and there's herniation. If there's a herniation, what would you see on physical exams? This is a key concept. I want you to write it down. And that is the Cushing triad. Do you know the component of the Cushing triad? Put down in the comment section. Let me know the component. There's three. It's a triad. There's three. When you have a head injury, things happen. Something happened to your blood pressure. Something happened to your heart rate. Something is going to happen with your breathing. What do you call it? It's called Cushing triad. And what is that? Your blood pressure is going to go up, hypertension. Your heart rate is going to go down, bradycardia. And what? You have what? Irregular respiration. And you have wide pulse pressure. So know this, very, very important. When I give you a neuro case study, you will see this, trust me. Now, this is a question. This is trying to put everything together to see if you can get it. But this is the way you should be comfortable. When you answer this question, that means you're comfortable, you understand the key concept. How do you read the question from the back? It's a select or apply. You don't have to pick everything. Pick those that you're confident. Which finding will score a model response of 5. That means we're going to get 5. We're going to subtract 1 point from getting what? Command. For obeying command. Patient GCS, model of 5. Ask yourself, what is model of 5? Write it down. Old band, right? Obey, localize, draw, burn, extend, and none. The localize will give you 5. Now, what does that mean to localize? What do you think? 1, client reaches towards the painful stimuli with purpose. 2, client pushes your hand away when you apply sternal rub. 3, client withdraw all external extremities from painful stimuli. 4, client brings hand above the clavicle level towards the pain. 5, client extend arms readily when you apply trapezius squeeze. Look at it. This is the concept. What does that mean to withdraw is the reason why I'm asking you, because this is classic NCLEX question to see if you understand it. This is what it means to what? Localize. If you're localizing, it means you have to distinguish between withdraw and localize. If somebody is localizing something, that means I'm going to the problem, trying to figure out why are you pinching me? If I'm sitting there and you're pinching me, I want to turn to you and say, look at you. So I'm not pulling away. So I call it what? If you fight the pain, you're getting the 5. So anybody that fight the pain is going to get 5. But if you feel the pain, that means you just sit there. You are what? Enduring the pain. You are not localizing. Localizing means you're trying to figure out where the pain is coming from. Withdrawing means you feel the pain and you don't do anything. Therefore, number 1, when you reach towards the pain, you are doing what? You are localizing. If you pushes away, it's the same thing because you feel the pain and you push it away. I don't want any more pain, right? You're fighting it. If you withdraw, that means you get 4. You're not going to get 5. If you bring your arm above your clavicle level towards the pen, what do you think? You're trying to figure out what is above you. You're trying to grab it. That means you're fighting the pain. So these are the answers that correspond to what? Painful stimuli where you localize. What is your score so far? I would like to know. And put that in the comments and let me know what you think. 2 more questions. What should the nurse do? Patient is in the ICU. He's on propofol. That means he's sedated. And then the provider wanted the nurse to check for GCS. What do you think she should do? Assess GCS while the patient remains sedated. Hold the sedation for 30 minutes, then assess the GCS, right? Document unable to assess due to what? Sedation. Consult with the provider about sedation holiday. This is a classic thinking question. Patient is intubated, is getting sedation, and you want to check for GCS. What do you think? Put down your answer. Let me see what you think. There is 2 answers there that may be conflicting each other, but there's a way you can approach it, right? This is very important. 10 seconds. Let me see what you think. Of course, you're not going to assess the patient while the sedation is not going on. You should not document that you are not able. Therefore, you left with 2 and 4. What would you do? Do you hold it and then assess the thing? No, you need to let the doctor know that, hey, I need some sedation. 30 minutes may not be enough. You may need a longer time for the patient to get out from sedation. And the key concept is what? Sedation usually artificially lower your GCS. So we got to make sure you're fully awake, and then we can do that. So the nurse needs some permission to consult with the provider about sedation holiday, and then we can stop the sedation for a couple of 30 minutes. May not be enough for them, even though it's on propofol, but just wait and let them know that, hey, I need an order for sedation holiday. I can't just go and stop the sedation and do my GCS. I need to get the permission, say, can I stop it? Stop it, and then we can, and the sedation holiday is a little bit longer until we 100% that the patient is fully awake and we can get an accurate GCS. The last question is this. This is to try to test whether you get the verbal aspect of it. I want you to try, keep on doing this on your own, and then you realize that GCS calculation is easy. A client make a sound like, oh, but no recognizable word. So this is the speech verbal one. This is what they're saying, oh, right? They do not follow the command, right? They do not follow command. This is what they're saying. Do you think we should give V1 for this patient, or V3, which is the inappropriate word, of V4, which is what? They doing what? They confused, right? Or V2, incomprehensible. Oh, it's a form of what? What do you think? I leave that for you. And let me see what you respond. You can send me an email about this. This is very important to understand what is the patient saying. Oh, is for any words you've talked to them about it. If you're doing a verbal assessment, what will you assign to this patient? Put it in the comments. This is our assignment. I'll respond to every answer choice, and I'll type whether you get the right response. This is Adapt NCLEX. If you like this video, if this video is very helpful to you, I'll put the actual content that you can use. You can watch it in the description. And if you want more content like that, subscribe to Adapt NCLEX. Thank you for your